Bill 841. And this is a bill on the coverage of healthcare services delivered by audio only. But what is here that is important is to our municipalities as they relate to tax abatements due to the floods and sort of having to need more time. So it's because of that, probably the amendment that it's particularly important to our municipalities. So if you
We
want
don't
to
have the
present,
amendment.
do we have a copy of the bill? The bill.
Yeah, but we're talking about,
No.
or we don't
well,
have to talk about
It's both.
it. Well, at least what was on.
All right, well, we'll.
I'll look at the one you gave to Phil.
Yeah, I've got an extra one. If you like.
Well, it's making a very clear effective date, except section 3, which is the flood abatement, which will take effect upon passage. So I think does everyone have it? Okay, thank you. So Senator Chittenden, you want to just run this through for us?
You all have very little time, so I'll talk really fast. I can speak to the telemedicine bill. I don't think that's why it came here. That it really just standardizing that change that was implemented during the pandemic. So I don't think that has impacts on the appropriations this year. I was talking to Senator Secretary Bloomer before this, and since this section 3 is really just changing the April 15th cut for the abatements of the flood ravaged communities to November 15th of this year, it could impact next year's fiscal budget or the education fund for next year. My impression from these discussions, and then when we heard testimony from the city managers of Barry and Montpelier, this isn't to broaden the amount of properties that are going to be abated. If anything, it's just that many of the people they expected to request abatement have not stepped forward yet, and that's partly because they don't want to be evicted from their homes, and they expect as the weather is warming, and also with the ones that they do have queued up, they can't meet the deadline, which was this Monday. So they're really just asking for more time to work through the requests this Monday. We added it to this bill, not because it's germane, it is arguably not germane, but we saw that this telemedicine.
Oh, we have a way of doing that.
The telemedicine bill was moving on a fast track. We have heard that it's likely to be signed into law, and we would expect that to occur this month rather than in late June or July. And so we saw this as a vehicle that would be beneficial for the needs of the flood ravaged communities of Barry and Montpelier as well as others.
Okay, this was voted out of finance on 601. Oh, all right, our clerk is anxious to start clerking. We have a motion to move the bill favorably, seconded by Senator Starr. Thank you for coming in. We work fast.
Sure.
Oh my goodness.
Yeah.
Do you need a net
No,
a Band-Aid?
I hope not. Thank you.
Well, we'll get you one if you do.
The cutting edge. Yeah.
So, we'll call the roll unless there's any discussion.
Senator Lyons,
Yes.
Senator Bertram,
Yes.
Senator Starr, or Sears.
Yeah.
You both are yes. Senator yes, yes. Senator Kitchell.
Yes.
Yes, the motion.
I want to know why it isn't the morel. I love morel.
I don't know, I'd have to ask Chair of the.
Oh, I like lion's mane. Oh, really delicious. So who's this is tax education, I guess. Senator Baruch, who's not here.
Education.
Happy to do it.
You'll have,
Well,
okay,
it's got healthcare, I think.
Yeah, that was.
it doesn't matter. All right, our clerk can be the reporter. And I need to talk to you about that. I know for sure. All right, so there's the bill and then we'll sign it, the reporter. All right, so Emily, you want to come up, please? Anna, do you want to sign? Yes. It's the money, right? Do they agree with it?
Huh?
Do they agree with it? Mhm.
So, yeah, motion.
Well, it's big, it's getting small.
I don't know, Tony, yeah, they are, Tony didn't print the big one. Or print it big today, but that's.
So, I'm assuming I've got two of the same.
Yeah.
I better date it. What is today?
It's right on the top, 412.
Oh, yeah,
They're
4/12. Yeah, I see it. Okay. Assuming we haven't had multiple versions in.
No, I think I just grabbed an extra one.
Oh, thank you. All right, so we'll start, this is our one-time revenue and expenses. And, this is just to keep moving forward and closing out the best we can. Needless to say, the tough decisions are ahead, in terms of, budget decisions. Well, this is the one time, and we have really two things about one time, one of which is the money that we actually have in hand. And then the other would be at the end of the fiscal year, sort of what we put on as contingent appropriation. The House did two, I believe, contingent appropriations. One was 20 million and the other was the 3.5 for the elevation of homes. So the question would be, agreeing with that or modifying it and also adding to it based on what we think revenues will be and just doing priority. So, all right, we will start with the top then.
Sure, so Emily Byrne from the Joint Fiscal Office. This sheet should look familiar. We walked through it 2 days ago, except the only difference was that the Senate column was blank when we walked through it before, so now it was the big sheet that we did. Now we filled out the Senate columns based on that conversation. And kind of dropped sort of what the one-time balance, if you will, looks like. So the pieces that we talked about that are new, sort of showing up on the revenue side, we talked about adding a $3.9 million transfer from the human services caseload reserve into the general fund to fund the global payment tail for Medicaid claims to start to move towards the ahead model. Additionally, in line G, we've added a TBD line for revenue from Senate Finance, and they're working on a bill right now. Once that's finished, we can fill in available funds from Senate Finance. The other items are what the committee talked about. I don't know if you want me to go through.
Now, why don't we just do the
All of them.
ones that are in yellow on hold?
Perfect.
And we could start with the 211 contract. We put that on hold because there was some discussion around, it was focused on housing and after hours and after a certain time. Just, you weren't going to get in the room. So, why would you, have the service? And, I think Senator Sears raised that question. Then have additional information. And so Senator Berkeley, do you want to add to that?
Yeah, and I did get a letter saying there's another option for you to go 24 hours, 5 days a week. But this month, this number is for 24/7, so 24/7. You could go to 24/5 and save, but it might drop down to 176. Did that, so 5 days a week, which 5 days? But maybe it's like paying people for those late night hours on weekends, it's expensive, right? So that's an option. But yeah, the information I got was that it was much more than housing. It was when they have like law officers, when you find somebody in crisis at 2 a.m., they don't know how to help them, so they say call 211. But they kind of, even though they can't give them a room that night, they can give them a voucher and get them prepared. That was the argument.
That would reduce your buying power.
Basically reduced by half if you did 5 days, 24 hours instead of 7 days.
So we can, and the price on that is how much?
176 and change.
170. Right. Do people want
Here's
to
the exact-
make a decision or just keep moving and see what we've got? Yeah.
Just go through reading.
Yeah, all right. The next one, and we've been trying to, crosswalk with a couple of housing bills that are in a different committee. And this is, manufactured home improvement. and the governor had 2, the House reduced it to 1. I think there is some, and if you could say tentatively, is the other, housing bill doing anything with manufactured home improvement?
I'm not sure if they're doing anything with manufactured home improvement. I know it was part of their conversation, but I don't know where they've landed on it yet. Same with VHEB, they're talking about it, I don't know where they've landed.
So we're gonna have to hold those to see, how much we want to, put in. VHIP got totally taken out and the other just got reduced in half, so the question is, what we want to do. I think, on the whole, we've been very receptive to VHIP because it brings, units
Well, I'm
on
in.
quite, quickly, so, all right, we'll just keep going here, because if you look at the bottom, this already puts us 13 million in the hole, so we're gonna have to make some choices about what gets added here or reduced. And the other one was simply that funding, bridge funding now is being picked up by another bill that we passed, so we don't need to have it on the one-time list. So we can close that out and get rid of the, yellow. Now, I don't know whether our folks from, ag, you were looking at, some reallocation. This is all one-time money.
Yeah.
The conservation group would at least like to have their base restored to the 612,500.
which we,
And this is only one time, so the question is, what do you want to do here? Or do you want to make a recommendation at this point?
yeah, I thought we were talking about splitting that between the conservation districts and the cash crop plus and cash crop. And they need to do cash crop to get their drawdown in cash crop plus, they need something like 240 or 50,000. And we would take the remainder and put it towards the conservation districts.
Now, what about farm share programs? You
Well,
said,
the farm share program has money. This would, what this would do is double the size of the program.
oh,
The cash crop needs at least 60,000 to match 3-for-1 federal money. So we don't want to disrupt that at all. And then the cash crop plus program, which has a pretty good multiplier getting food into the hands of
so
individuals.
just to make it even, what you're proposing is then to say reduce,
Down to 250.
down to 250 and then 200 for conservation.
Yeah.
Assuming that we can make the money work.
Yep.
The only comment, again, I'm gonna reiterate, anything on the one-time list is not a commitment to ongoing expenditure. And it's very troubling when people come in and say, well, we got this much last year and you're cutting us. And, when we have some extra money, it's nice to move it out and let it do some one-time benefit. But, we are routinely gearing back, well, this is what we got last year, so that's the new base. And if you look at what we've been able to do with all the federal money and putting it out, and the impact that that had on our general fund revenue as a result of all the economic benefit, this would have put us into a spending level that we simply cannot sustain. So, I just want to, anybody who's listening and anybody who's in the room, this, if you want to come back next year and say, well, this is what we got and you're cutting us, be forewarned that that probably isn't going to be a very good argument for, why we aren't able to continue that level of funding. So, all right, on the next one, we're taking that out. and that was one-time money, because that's the urgent care. So we took that out because we got testimony that the federal grant money will continue through another year. And, what we are talking about is looking at those community-based providers, and see what, we could do to give them some reimbursement increase across. And not, I believe not all the VAs operating these programs or have grants, so, doing something on a more universal level. Benefits more. The, 391, that's been taken care of, that's a one-time payment of the tail for that, hospital global budgeting initiative with 5 hospitals, so that's a close out. And then vacancy savings.
You're not gonna do the vacancy savings.
Why is it highlighted? Didn't we just say
I
that?
think just like, this was a difference from the house decision.
$5 million.
Yeah.
Yeah, so you're not gonna book that 5 million of savings.
So they did it on time. Well, they only did it.
Still doesn't matter. It means that they're gonna have to, in an already tight workforce,
That
they're
was a
gonna.
joke.
Oh,
Chair.
thank you, I'm sorry, I'm, by Friday afternoon, my joke filter.
Well-
Well, I thought it was funny that the chair of the House Appropriations Committee came in and said they were critical of the governor having 57 million in vacancy savings, and then they went to 62. Was.
That's what I was.
So we're short that far.
No, it would mean that they would have to delay hiring, for positions over and above what they already have difficulty hiring, because of the workforce environment. So we decided that that was not prudent budgeting and, it's, not something that we want to put down. So let's keep going here. And we're down to, I did, in the last time that we went through this, I had a note that I would check with Senator Cummings. Well, this is a tax study that would basically, evaluate Vermont being the first state to attempt to, tax your unrealized capital gains. I don't know if you get a tax credit then when you have capital losses, but she felt that this was not a tax policy that made sense. It's been very a topic of a significant criticism in terms of what impact it would have, particularly people who sell their business, and it's a one-time. But I know that it's been looked at as something somehow understanding who fall into that bracket and exactly what will happen. Has been a lot of concern. So her conclusion was there was no need to study something that we weren't interested in pursuing, to put it bluntly. Yeah, and I'm sure she was more diplomatic than us being right now. So, that's reflective of my conversation. So, based on that discussion, we're gonna remove that money. And then a municipal grant, and this is a crosswalk with what's happening with our housing committee, which is doing Act 250 reform. There's some, there's provision in there to deal with the property transfer tax and, giving more money to municipal planning and to support Act 250 reform. And so we need to just confirm that in fact, what is here is sort of embodied or embedded in the work that, would be, part of that bill. And we think that it should be, but we haven't got confirmation of it. So that needs to be held still. We did find the money for the memorial for St. Joseph. Last time it went with 25,000 went through the Crime Victims Center.
Yep.
So this would be 60,000. We want to close that out.
Yeah, for the memorial.
Yes.
Everybody's aware of this. A really long effort to settle the issues for the victims. And it's the memorial
Been part of that dealing.
Yeah.
Kind of, there.
process that we've helped them with since lot of credit.
Well, this actually, now do they have
I think
sufficient
they would
funding?
have the funds to complete the memorial
What we gave them?
with what they've given before and what they've raised.
So we, with this, we would have given a total of 85,000 toward
Yeah.
the memorial.
Yeah.
Which is not insignificant.
No.
Then we had a request, for adult days, and this is to, we know that we have certain areas where the adult day program shut down. This is to, fund the startup of a new one, I believe, in Barry area.
Yeah.
So we put it on the list.
She's talking
On the
about,
list, yeah.
It's on the list.
she's talking about 50 replacements, so it can vary. I think during COVID, 3 adult days were lost statewide, and Barry was the biggest.
Yeah, right at the beginning. Did they have a location?
I can show you, but she gave me a tentative budget, for what she needed. The woman that's doing this is, works at, the home health agency here in Central.
Did we add, and I realize you've got quite a few did we add the 300,000 for the Center for Crime Victim Services from the, trying to take care of the era that led to the $300,000?
We're putting together all the requests
Okay,
for one time. We've got 5 million for brownfields. We have got 500,000 for
Yeah.
something else that just came in. We have got, from BSEA, they want to have us do 3 studies, 4 studies. So we are getting, I don't know, I think I'm about to say, as of today, if you don't have your request in, you're just out of luck. There's, at some point, this committee cannot continue to get as though we are back in a public hearing mode. This is what we were attempting to do, and we're just getting crammed with last minute requests, but that I believe is on our list.
okay.
And if it isn't, we will add it. And the other thing that you mentioned, and that was the fine revenue coming into the judiciary, the one-time 2 million on the IT system. Oh, that's on the list, and we're compiling it so that we can figure out what we do and how much we can do.
Oh, absolutely.
Allocation.
No, I understand.
So and I realize that it's Friday afternoon, but I've never had a week like this has been in terms of everybody handing me something saying, don't worry about,
I'm gonna hand you another list.
Well, thank you. It'll give me the weekend maybe to ponder it, but
Oh, no.
it's becoming very, very difficult in this last stages to do it, but we know that we've got a lot of requests for base increases. And they far exceed what the Senate is going to be willing to support. And we will know what that box is after we get the bill out of finance, but it is going to be very, very different than what came over in multiple bills and in the budget. So I've said that about 5 times and I'll say it again.
Yeah.
What we're gonna do is prioritize all that spending. And we'll do the best we can. So what are you up to? About 10 million?
Not quite. Oh, yeah, a little more than that, actually. No, seriously, we did talk about some of our priorities in health and welfare, obviously, and I want to know when you want me to share those.
We're just gonna put them on our list. We're gonna be taking a list. And we'll,
Amy did a great job of putting it all together.
and we know one of the biggest ones is the Medicare cliff.
That's on your list.
Which one?
The Medicare cliff,
Yeah, well, we are
are you on there? It's not on there?
I'll put Medicare cliff on with that. What are you talking about?
I'm talking about for the Quimby, Slimbies and Cuties.
Oh, we haven't done that. That's in a bill. That's a whole separate, that is a separate
You
issue.
don't need to do a separate bill. We'll go into the budget. It's
Right,
just
we
the
will bring it
amount,
to
which
you.
option we are gonna be able to.
I think
afford.
we're looking at that early in the week, but I think right now, if I were gonna guess, it would be at the middle bar that we had talked about this morning.
All right. So, that was a prior, but our problem is in order to make the budget work within the governor's box, a lot of stuff that was in the governor's proposed got pulled out and put into other bills that are not gonna move in the way that they did in the House. So it is becoming extremely complicated to extract what it is that we're prepared to appropriate money for. And that's gonna drive the amount of money. Obviously, our finance committee is not willing to raise the level of funds that,
Thank you.
this collection of bills has, represent. So we'll keep going here. The next is one-time transfers, and we really, the question is here on, unsafe dam revolving loan fund. The governor proposed $1 million, the House agreed. Our committee wanted 1.5 to bring it up to a total of 2.5. This is tentatively $1 million, but it's out there for discussions.
Is it highlighted because it changed that, or did it used to be a different number?
It's weird because it was open for discussion. I left it at the million.
Because it relates to 213.
Yeah, and I did put the 1,000,005 down below in the one time in the Senate bills, because it was part of S2.
Okay, that's where it's.
Yeah, so, and we'd have to pull it out one or the other, depending on the amount. Okay, so let's keep going here.
So for the Senate bills, so the grant and per diem compensation for the working group, the Center for Crime Victim Services in S120. S55 has a working group, for the open meeting laws recommendations. S159 has another working group related to regional county government. Funds for the per diems for that. There's a study and then there's a working group, I believe, in S159. There's two pieces to that, and then the open meeting laws is what, sorry. S181 includes the streaming tax. The tax department needs to do the implementation for
And
that.
that's non-negotiable if we want the revenues. So we've got to fund the, implementation.
Okay.
The ones in yellow, and I have to compliment Senator Bray, went back and looked at 213. He looked at the priority setting, that was provided by Secretary Moore. And he has gone back and, set some priorities in terms of how to make the fiscal impact of that bill, more affordable. And we need to just have a chance to vet it, because he just brought it in at noon. But it was very, I wanna just recognize his willingness to take a look and come back with what would still be workable, to make that bill effective. So we just need more time, and we have to have. So we're keeping that open.
Yep.
Okay. And 310, that's the, other flood related bill. And that is to provide the same level of grant support to the municipalities that happen to have their floods 4 days later than the July flood, or whatever. So that's something we felt, in fairness, if we're doing, relief to those communities, it shouldn't be a matter of you got flooded 4 days later and you get nothing. So that's what that, amount is. On flood impacted communities. And then, urban search and rescue. That is something, and Senator Burchett can talk about it, but it was in 310. And we did include the language to make it official so that they could draw down federal match. In the, bill that was passed, the request was 250. When they came in our public hearing, they wanted 750. So we put down the full request. I asked the chair, why it went from 250 to 750, and she said her committee just wanted to endorse the higher amount, but, we obviously, the amount that we give, toward that is, still yet to be determined. And I know Senator Birchwood had some conversation about, the money here.
That would be kind of the minimum, is what they said. It's mainly for training, so that they can prepare and have everybody ready for the next emergency, so you can have people do rescues if there is floods, but they do all rescues. It's Swiftwater is the name, because that's the way the feds title it, but they do search and rescue of all sorts, of all kinds.
Well, we aren't making any decisions right now.
They wanted it to base.
Yeah.
That's what they wanted it to be an ongoing.
And then, either the Medicaid expansion startup, and that is, well, that, whether they go to the Medicare, cliff piece, right? Yeah. And, so that's, is, open. So with that, if you look,
So yeah, so fine, line,
we look at the bottom line,
yeah, I can walk through how we get to the bottom line.
All right.
So that's
it seems to have brackets, it means we're in the hole, Emily.
yes, fortunately, we're in the hole. That, it's not too deep in the hole, it could be worse,
Well,
right?
we don't have all the one-time wishings.
True, this does not include everything.
There's another, there's a memo there, two memos I gave you. One is just is language, but the other one underneath that from By State Primary Care is an update on their work with, Viva around the reimbursement. There's an explanation on the back that, because there was a difference of opinion, now they worked together and found a solution.
So they want an additional 1.8 million?
I think that's what the request is, and on the back is.
Well, I know that Viva, a number of the FQHCs are working on, change of scope. And, based on my conversation with Stephanie Barrett, that's gonna result in, the recalculation of reimbursement, and that is, the preferred way to go.
That's what
So-
that is. And that is language, we talked yesterday about the implementation plan, but this changes the language to make it, a study. If we decide to.
I'm not emoting on my view on
I see
studies,
you.
but this is a $4 million new program and expansion, so that even though it's changing it from a plan to a study, so we've got proposals from VSEA that they would like enhancements to the pension plans, which we know would carry more money, and we already know we're spending several hundreds of millions on pensions and OPEB right now, so
That's the last breadcrumb from S-215. Beside this.
and we will be making a list of
Right.
all the other one-times. So even with what we have here, we're 13 million in the hole.
And the assumption there is, so with what's listed up here, plus the Senate bills, that gets you to negative, 4.56. And then the 9.28 is if we took all the items that are on hold and put them in at the level that the House did. The one exception to that is VHIP, which this House had at 0, so I added the governor's recommended, you did 6 million for VHIP plus everything on hold. That was funded at the House level, that puts you at 13.8.
And when you say everything on hold, do you include just what's in yellow or only where it says?
I should have, the two where it says hold that are not yellow should have been yellow. So it is everything that says hold or is in yellow. So that is the 211,
And healthy homes, did you put that at 4?
the, I can't remember for the 12/24 part, it's the cash crop plus one.
You said you did,
urgent
you said you
care.
did whatever the House did?
Yeah, the healthy homes we have in right now at, 2.
That's correct, double check.
So if it was 4, it'd be 50.
Or if the other bill should carry some money for healthy homes. Then that would ask the page now.
Well, the cash crop is about the same amount, but it's just divided.
Yeah, we're not making up any money, it's just how you're divvying it up. So, committee, what we're going to do, Emily, do we have other documents?
Not today.
Not today. So, what we are going to be doing and providing, it's sort of a total list of everybody, the requests that have come in. And they're coming in a variety of ways. Some have come in emails, some has just been a conversation with a member of the committee. Some have come in as a matter of a public hearing, and we're really struggling to make sure that nothing is not out there for consideration. And that will be our challenge when we come back next week. Is to look. Also, we will have a bill that's coming out of finance. It's a good relate to how much money we have available. To
They're
work
doing
with.
that today, or?
They're gonna vote it out today. And so, there are, next week is gonna be a busy week. And I'm not sure, our goal was to move this bill out on Tuesday. But if we have committees that are still giving us information on Tuesday, it becomes very difficult to give same day, turnaround. So we may have to slip it a day. I'm not sure. We'll have more discussion with the pro tem's office.
Are we meeting Monday?
We will not meet Monday, at this point.
So this is a list of the bills that are in our committee, and the one that you've already identified, which is the Medicaid. There's also an emergency medical services bill that is going to be going to GovOps as well. It is on our priority list for the $300,000 for education, but it comes from a special fund.
Is that the one we just increased in the other bill in 310?
I think
I think so.
no, this is emergency medical services.
I think 310 had the same language,
Is it the same
It's the
language?
same,
Oh,
there.
but it's different.
And I was worried that it was
I
additional
believe it
funds.
is, but I'll double check.
And there's also Medicaid non-transport
Yes,
dollars.
and we have to do that.
Yeah, okay. It's in this bill, that's all I was gonna say.
Oh, okay.
All the others are special.
And the price tag for the dealing with the shortfall and reimbursement under the current Medicaid methodology is about $500,000 general fund. So that's another, request. And we have to meet, Medicaid transportation is a required service. And, the methodology that for those of us who are on transportation has not been adequate to meet the actual cost because so many individuals now need to go to methadone every day. Or, as I've said, people have had to have specialized treatment in Boston or, very long, expensive transports. And so those of us who are working on the public transit budgets know that they have no capacity to cross-subsidize, these very costly transportation services. What we did already is to deal with it for 24, but what we confirmed is that the House budget per se, but obviously travel, this is an example of trying to remember to pluck stuff out, has to go in the budget because it's an entitlement and we have to provide the service. And so what is in there is 300,000 for emergency, but that's ambulance. It's not the non-emergency. So that's on our list. Good, okay. So with that, it's 1:45. And I'm gonna suggest that at this point, we're gonna try to get this organized, find out what we're dealing with from a bottom line, ensure that we've got every request. And then next week, starting on Tuesday, we might have some late nights, I'm not sure, but we'll just have to do our best to, figure out how and where and how much.
Fortunately,
Somehow,
and I have late nights with.
somehow we gotta get a message
Oh.
to committees, I mean, them sending out bills at the 11th hour.
So,
You can say-
Mindy, do you have any other questions? Otherwise, I could adjourn
Not as much.
and let everybody in the room go back to their